Hello, everyone. Hi. Actually, Robin, maybe you should do a welcome this time. We're just gonna chat for a bit whilst the room fills in, but I think maybe Robin should do a welcome on this one. I'll be doing a lot of talking. They'll probably be sick of me by the end of it.
We're missing the teddy bears from last year.
No, we are, but you know you've got ducks instead. Look, can you see the ducks?
I thought you were going to save them up till later.
And they're Halloween ducks as well.
Halloween duck.
The sad thing, we're recording this as well, so that's forever an archive now. Me talking about my rubber ducks from.
You see that? That's your credibility floating past you.
What can I say? We're just waiting for the room to fill up a little bit. Hi, everybody.
Do say hello, loves.
Yeah, do say hello. Go into the chat and just say hello. I know we've got lots of people from lots of glorious regional venues on the list. I went through the list and it was really exciting. So tell us where you're from and I'll open the chat button. Hi, Phil.
Hello, loves.
And Dan, hi. Cool. Robin, do you...
Hello, the unicorn.
Yeah. Do you want to do a little bit of an introduction, Robin, or have I just put you on the spot? Would you like me to do it?
No, not at all. I'm just waiting for a pause in the natural conversation. Hello, everybody. Nice to see you arriving. I think people are still coming in, so we'll continue to chatter away amongst ourselves. But do please say hello on the chat function so we know where you're from and that you're joining us this afternoon. Oh, fantastic.
Queen's Theatre Hornchurch, hello, Barbican.
Hello, Dominique from the Royal Opera House.
Yeah.
It's lately elevated Dominique from the Opera House, if I remember correctly, if I read somewhere. Congratulations.
Oh, very good. Hi, Kevin from Beck2. And hello, Guy. Very nice to see you. Are you joining us from the Albert Hall or are you joining us from locations otherwise?
He's going to respond.
Lots of people from the Barbican.
From home, yeah.
From home, very good. Very good to see you. Fantastic. And still people coming in, which is really good, especially for Friday afternoon. It looks like we've started to settle. So perhaps we should start to make a start. So welcome everybody. Thank you very much for joining us. It's really great to have you with us this afternoon for today's webinar, which is an opportunity to present the findings of the Backstage mental wellbeing follow-up survey that was conducted earlier this year. I'm sure Mig will explain how it relates to our earlier survey, and then we'll outline some of the key statistics that she was able to discern from a really, really high level of response, which was tremendous to receive. As I'm sure many of you are very familiar, we are on a Zoom webinar platform this afternoon. Please do feel free to add your comments to the chat box, as many of you have already done, and it's great to see you all there. If you have questions that you would like or comments that you would like addressed, please put those in the Q&A. And David and I will try and make sure that Mig has the opportunity to respond to those. Mig is very much our expert panelist this afternoon, as she has been so closely involved in preparing, administering, and then analysing the survey. And we recommend that you have gallery view, although I believe, Mig, you'll probably be sharing some material this afternoon which doesn't require any of us to do anything, but you will see the material Mig would like us to review, and when she's finished with that, it will disappear and we'll go back to the panelist view. Is there anything else that I should have said, Mig, before I hand over to you to allow you to start? While you find your mute button.
While Meg finds her mute button, the idea is that when Meg's finished the presentation, there's plenty of time for question and answers at the end.
Sorry, I was preparing my screen share, and then because I've got a Mac, this is definitely a first world problem. All of the things shuffled around and I couldn't find you, but I'm back. No, Robin, I don't think so. I think we're all a bit versed to it, really. I think the only thing I'd like to add is, as you can tell, I'm at home on the boat. I don't have fancy fibre network, so a contingency plan is in operation where David will hold the realm, and I promise that I will endeavour to get back on as soon as possible, maybe tethered to my phone. So we've got a contingency plan in operation. But yes, the agenda for this seminar is I am going to show you some, I'm going to give you a roundup of the report. So hopefully some of you have had a little bit of a glance at least at the executive summary, but I'm going to go through it and I'm going to try and whiz through it. It's probably one of the most boring PowerPoint presentations I've ever done, because there is no glamorous way of making statistics exciting, but I promise I'll do my damnedest to make it as exciting as I possibly can. I'm going to try and link it wherever possible with action points or things that I think we should consider, because I'm aware that just presenting data with no tangible things to consider in terms of action points is not always useful. And we're going to try and endeavour to do this as quickly as possible, because I've got my own recommendations that I'd like to discuss with you, and also just open it up as quickly as possible to questions. And I really want you to chuck some. I may not have all of the answers, but if you chuck them at me, I can definitely go away and find the answers for you, and that will help me develop the guidance notes as well. So without further ado, let me screen share. Someone let me know if that's worked.
Yes, it has.
Lovely. Okay, cool. Let me go back to this front page. So hopefully most of you know me, but if you don't, my name is Mig Burgess, or Mig Walsh, whichever one you prefer to know me by, that's fine. I'm a senior teaching fellow at the University of Surrey, and I teach on the production course at the Guildford School of Acting, which is a conservatoire that sits within that university. I'm also an ABTT trustee counsellor, and I'm the chair of the AAPTLE Wellbeing Working Group. And I'm also a lifelong mental health patient, which is where my interest in wellbeing and mental health comes from. So this survey, I'm just going to take you through it from the start. I think the first place to start is, as Robin mentioned, we had an absolutely fantastic amount of responses, which was just brilliant. We had a nice, fabulous number of 1,234 recorded responses. 722 were fully completed. There were 512 partial responses, but I really wanted to highlight how good the data is that we got, because from those partial responses, 1,122 either completed it fully or completed it to 80%. So we got a really good response rate, and normally these partial data responses in bigger surveys is much higher, so we did really, really well. And I also want to just declare really, really openly that even if people only completed 1 or 2 of the questions, I still counted their data. So all data was recorded in this survey sample. I've tried to put some infographics in for you just to make it more interesting. I'm definitely more about a picture than I am about text. So that gives you a bit of an idea of the age range. We had a very good turnout from our young people. Our 18 to 24-year-olds, that was fabulous. But obviously, predominantly, we're looking at career levels of 25 to 44 were our most prominent age areas. We already know from Freelancers Make Theatre Work, I think their data tells us that 71% says identify as being freelance, but of our survey sample, 69%, which is in correlation with Freelancers Make Theatre Work, identify with being freelance, but I will declare to you that's either 100% freelance or people that work freelance and PAYE, which I very much include myself in that. So I teach, but I'm also a freelance lighting technician at the same time. So we have a huge contingent, and I think categorically we now have definitive data along with freelancers make theatre work. I've included this mainly for sort of stage sight and stuff. So there was some other bits of data that I popped in the survey to supplement some other working groups within AAPTLE. And it's worth noting that 94% of our participants were white. So obviously we have some work to do in diversity. This was brilliant. This was one of the highlights for me. In 2019, when we did our first original mental health survey, when we launched it at Plaza in 2019, only 1/4 of the survey participants, that was about 1,300 people that took that, were female. 3/4 of our survey sample were male. And so it's just absolutely amazing to see that the statistic is evening out a little bit. So we had 51% identifying as male and 46% identifying as female. And that was brilliant. And this infographic will probably show you why. So this is the principal area of work. Obviously we had a fabulous turnout from our lighting, team lighting, audio, stage management, costume. Other, interestingly, other is really, really high. The reason that other is really, really high is we really tried to push this survey out beyond the theatre market to live events and rock and roll to include some of those. And most of the other section includes trucking and some roles that we couldn't include that people wanted to be more specific about. But I thought it was really interesting that other is so high up there in the statistical data. I popped this one in here just to look at equality and inclusion in terms of the male to female ratio. Some of the working groups within AAPTLE were interested to know the male to female ratio. Obviously lighting and sound very similar. Lighting particularly more male dominated. Sound marginally a bit better. Stage management predominantly more female orientated. Costume that has a problem probably attracting males by the looks of it. The one that I would quite like to highlight, if anybody is out there that would like to look at it, mainly because I never made it to technical manager, but I do think that if you look at production management, the ratio of male to female is quite interesting. I think it's quite close together. As a data analyst looking at technical management, I'm questioning why the female ratio is so low when it's so more even in production management. So that's probably something that that maybe that kind of area would need to look at why you're not attracting females into that technical management role. We also looked at hours worked. It's worth noting that 66% of our workforce work over the national average of weekly hours. So the national statistics sit somewhere between 37 and 38 hours. And you can see from this data that majoritively people are working over that. And it is well documented that working hours and work-life balance is a huge factor in looking at well-being and mental health. Right, so this is the bit that I really wanted to get into and try and categorise prevalence. So in the 2019 survey, we asked the question, do you currently have or have you ever had a mental health condition? And we ended up with a statistic, but I wanted to categorise that even further in the 2021 survey and just categorically ask, do you currently have a mental health condition? And our prevalence is sitting somewhere around 40%, 39.5%. Depending on what statistic you look at, the national average at the moment is sitting somewhere between 1 in 4 or 1 in 6. So we are considerably, it's worth looking at the fact that we are higher than the national average of mental health prevalence. And we already know from our 2019 survey that that our workforce generally tend to have their mental health condition before they come into our sector. So we actually attract people that are more prone to mental health conditions. And we know that from our data from the 2019 survey. In 2019, we also learnt that the prevalence was much higher in women, and that is still the same now in 2021. So men at 32%, women, it does shoot up to 40%. So the prevalence is a little higher in women, and it is worth considering that when you're beginning to look at action plans in your workplace. I also did pull the stats on anybody that identified as other or prefer not to say in terms of gender, and that statistic shoots up. I think it sort of stands to reason that if you're having troubles with identifying with gender, that in itself is well documented in the mental health world, that it comes part and parcel with mental health conditions. So again, it is worth considering that more if you have staff that identify with other or prefer not to say. So the prevalence shoots up in young people, and I thought this is quite an interesting statistic. It's at 20, so it sits at 22% under the age of 24 and 59% under the age of 34. So nearly 60% of our workforce are identifying with mental health conditions under the age of 34. So I would say somewhere between 24 and 34 is when you establish your career. So the prevalence sits quite high with our young people. There is no real difference in prevalence between white and other ethnic groups. I did want to try and pull that data and see if there was anything. So white was 39 and the other ethnic groups were 40. So I thought that was quite interesting. But it's very, very high in students. So when I pulled the data and statistics for students, it sits at 57%. And as a researcher, that is definitely something that the AAPTLE Wellbeing Working Group would look to further research to find out why our students' prevalence is, why they're feeling, why it's so high, why that prevalence is so high. There was a slight difference between freelance and PAYE staff, so obviously wanted to see if there was a slightly higher prevalence working freelance, because we all know working freelance is slightly more challenging than PAYE. But there wasn't anything really remarkable about it. So 38% prevalence in freelance staff and 33% in PAYE staff. But I do think the whole of this survey has led us to, we do need to consider the freelancers. The pandemic didn't increase mental health prevalence, and of course, obviously in 2019 we know that we attract people with pre-existing mental health conditions to our industry anyway. So it was quite interesting to know that there wasn't a huge remarkable statistical data of people suddenly getting mental health conditions. However, 83% of people said that the pandemic period did make their mental health condition worse. So that was an overwhelming result there. This one I really wanted to highlight for you. So we asked what mental health condition you have, and people were very nice in responding to that. We're very much in line with national statistics that depression and anxiety were the two top areas, which is absolutely bang on trend nationally. But I wanted to put this little infographic here for you, which is the pie chart here. So around about a third of depression, a third with anxiety. But if you look at the all others category and have a little look at the bar chart, if you start to look, you've got bipolar disorder, obsessive compulsive disorder, panic disorder, post-traumatic stress, psychosis, eating disorder. All of the other ones other than depression and anxiety, they all very much fall under what we call a secondary mental health condition. So we have primary mental health conditions that are predominantly managed at GP level. So your GP can prescribe you perhaps a short course of antidepressants. They might be able to refer you onto some talking therapy, those kind of things. A secondary mental health condition is when your condition is just slightly on the severe category and you are then referred to a community mental health team in much the same way that if you had a physical condition, you would be referred perhaps to a specialist in their field. So it's worth noting that a third of the people that told us about their mental health conditions identify with having a secondary mental health condition. So in my mind, I think 1 in 3 of us have got a fairly serious mental health condition. Oh, hang on. Right, so we then looked at mental health support. So worryingly, 44% of people with a mental health condition are not receiving any help. And that's a sort of quite alarmingly high statistic. 68% of people don't think that there's any adequate mental health and wellbeing support for their return to work. And you'll see throughout my presentation the level of despondence in the people that took this survey. They just don't think that the powers that be in their workplace care. And I think that's ultimately what we have to change culturally. They don't feel like anything's going to happen. And so we need to prove them wrong if we're going to retain our staff. This I pulled some extra data for. So 8.38% said they don't have a support network at all. The reason I've pulled this is because if you don't have a support network at all, you're in a really high suicide risk. And you're really in a really high risk category in terms of mental health, and those are the people that you need to be looking after. So when you pull it as a data statistic, it only comes out at 8%, but in reality I've given you the number there. That was 181 people in our survey that identified with not having a support network. And when I further pulled that analyst data, 69% of those were freelancers. So it looks like our freelancers, because of the coming and goings, don't feel that they have as much as a support network, and it's definitely something that we need to consider in our planning when starting to look for provision for freelancers. So this is obviously quite worrying and quite distressing for me as a patient, but 72% don't feel that they can take time off work for a mental health reason. And worryingly, I put in there very specifically including doctors and professional help. So if they did get offered perhaps talking therapy or some one-to-one psychotherapy, they're really feeling like they can't take the time off work to do that. We also asked a number of open questions, which was really, really interesting, and we got some phenomenal results. Open questions in a data analyst world are a big no-no, really, mainly for 2 reasons. They're really hard to analyse the results, and B, most people don't respond to them very well. When you open a question very broadly, people either tend just to leave it blank, or they just write a few words and they don't have anything to say. The responses we got were phenomenal. So the first thing to take from this is that 1,234 people had something to say on this topic. So 640 people responded to the open question, why do you feel that you can't take time off work for a mental health reason? So 52% of people that completed the survey felt so half the respondents responded to this, and 96% of the text data had a negative sentiment to it. And the word cloud that you see there, it's on my right, I don't know what side of it is on your screen. There's some of it. So freelance, money, cover, show, it's all tangible work things. The reason they don't feel they can take time off work is because of their commitment to the job. So we're all so passionate about making shows, creating shows, putting shows on, that it's to the detriment of us looking after ourselves. And actually, I think that it's time that businesses, management, HR departments tell people that it's okay. It's okay. The show doesn't have to go on at the detriment of your well-being. So basically we asked the question, do you think there's a difference between physical and mental health? And this was an overwhelming data statistic in a survey. 98% of people think that there is a difference between physical and mental health. I'd actually quite like to meet the 2% that don't think that there's a difference. I thought that was quite interesting. 66% of the survey sample, which was 813 people, responded to this question. And I will, given time, do a proper report on the responses, because it just broke my heart to read some of the responses on this. 88% of the text data had a negative sentiment. Stigma was mentioned 78 times, weaknesses 30 times. They mentioned a lot about how it was invisible and how it was hidden, and they felt like it would be better if it was like a broken leg. It would be much easier to talk about. And again, people also mentioned that it was due to people just not a lack of understanding on the topic. And the word cloud that you see there is, it was pulled from that data. There was an awful lot of data to read through there. This, for me, if I could have it on my tombstone, I would. This was the highlight of the survey for me. We asked our managers, we asked, are you a manager? Do you manage people? Are you a supervisor or a line manager that manages people? And we said to the managers, do you think that your staff can talk to you about mental health? Or do you feel that you can talk to your staff about mental health? And 84% of the managers went, yeah, absolutely, 100%. You can talk to me, that people can talk to me about mental health. So there was an overwhelming confidence from our managers going, yeah, people can talk to me, it's no problem. However, 60% of people feel that they just can't talk to their employers about mental health. And therein lies the problem. So we have overconfident managers and staff that don't feel that they can talk to their managers. So we're living in this land where we don't think there's a problem, because our managerial staff think that they are confident and happy for people to talk to them. But when you ask your staff, they're not confident talking to them. And that's your problem. That's the cultural change that you have to change. So of the small 25% of people that were humble enough to say that they didn't feel that they could talk to their staff, we asked, why do you feel that you're not able to talk to your teams and staff on mental health matters? And we only had 48 responses to this question, because like I said, most people were super confident and happy that they could. 68% of people responded, gave an answer to this question. And training, so this pie chart up in the corner pretty much sums up what it is. So training and education was really, really high. It was really lovely to see that 11% of people mentioned guidance notes. It's coming, guys. I will, just bear with me. I will do the guidance. And again, support from company. 14% just said, I don't know, and I'm totally with them. So sometimes we just don't know the answers to something as broad as mental health. And worryingly, people are worried about legal issues, or they don't want to talk about their mental health, and that's okay also. So again, we then asked why people don't feel they can talk about their mental health at work. And again, we had 2,401 responses were recorded. The reason we had so many responses is people could do multiple answers to this question. Loss of future work comes in at the highest, and obviously that is intrinsically linked to freelancers. But again, this pie chart looks at it, and it was stigma, fear, being judged. So that's just a lack of empathy and a lack of a cultural change backstage. Again, we're looking at practical issues, freelancers, loss of work, those kind of things, and a lack of understanding that mental health not being perceived the same as physical health. We also asked how they would like to communicate, if they could communicate at work, how would they like to communicate it? I'm just going to be really bold here and say that we've got a couple of really lovely phone lines available to us. But according to my data, people don't want to talk on the phone. So of the statistics that I had, only 8% responded to the phone. Overwhelmingly, people want to talk about matters of mental health in person, one-to-one, either with a HR person or a line manager, face-to-face. Email was quite interesting. So 18% said that they would respond to an email. By an email, I just mean like maybe you could have a wellbeing email, wellbeing at whatever establishment you have, and then knowing that that is a confidential address that you can perhaps ask for some assistance from in the first instance. I don't think that the rest of the correspondence should carry on via email, but I think it is a nice place to reach out in an open, safe environment. And also, I think that if you have a bespoke email that is just for well-being and mental health, it doesn't clog up other people's emails. So when I reached out at work, when I really needed support last year, I dropped an email to my line managers, and it was at a time during COVID when inboxes were just mad. And I felt like maybe that was why it wasn't responded to with the same kindness that it could have been, because of course it got lost in a sea of other bits and pieces. So taking out wellbeing and popping it in its own bespoke box could be a really interesting way of looking at it. And again, I don't necessarily know the answer to this, but really worryingly, 1 in 3 participants feel that bullying is a factor for their poor mental health. I just feel like that A, that's alarming, and B, bullying is something that can be absolutely 100% managed by good reporting structures, business strategic reporting structures via HR, grievance policies, and good managerial structures. So if bullying is a problem in your establishment, that's a really simple one to fix. But again, culturally, you have to cultivate an atmosphere where people feel safe to report it and they feel heard. Again, we looked at people that did and didn't work. So it's fairly even split between people that have worked and people that haven't worked during the pandemic period. And I've got an infographic for that also. 51% of people are thinking of leaving or maybe thinking about leaving their backstage career. I think we're all starting to see the effects of that. I know that I'm getting lots and lots of phone calls saying, have you got any graduates? Have you got any students that can do this? We've got a staff crisis at the moment. And we need to work on staff retention, and we need to make our industry an attractive place to come and work again. Because we've lost people and they've gone off and pursued other options, perhaps options that give them a better work-life balance. And again, I've already mentioned this one, but I've popped it back up on here in this section. But overwhelmingly, whether you have a mental health condition or not, the pandemic's effects on our industry. So what you also have to remember is that what the devastating effects had on our industry can also impact people's mental health as well. So we all have our personal issues, but we also have the worry that will we have an industry to go back to? And 75% of people just found that completely overwhelming. And again, 79% of people who don't have a mental health condition just struggled with their mental health during the pandemic, to be expected really. I'm just going to whiz through this one, but it's all in the report. The main changes in behaviour were sleep, exercise, eating, drinking. They were either doing more or less of those things. And that's worth noting. 63% feel that the thought of returning to work is causing them stress and anxiety. And we asked, what are you most anxious about when you return to work? And again, you'll have a little look on here: skills, confidence in the job, travel to work, working hours, work-life balance. It's all here. The information is all here for you to digest. If you read it, you will begin to understand what your employees are worried about. I've done the hard work for you. Just give it a little read and then start to think about it. Income, pay, pressure and stress, pace and stamina. The data is all here for you to analyse. And again, this was an open question, and we had 820 responses to it, which is unheard of in an open question, like completely unheard of. If anybody would like the answers to the open question and would like me to anonymously pop all of them into a report, I'm more than happy for you to do that if you want any of that data to trawl through. 48% of people are not confident or not sure that returning to work will improve their mental health. And that's in line with the data saying in 2019, do you think that working conditions within the industry can contribute towards your mental health? And that was a 53% overwhelming yes. And 90% of people answered yes or maybe. So I think we've got enough data there to say that. And again, the skills fade as well. People are really, really nervous of. So I really hope, it's probably too late because I know a lot of people have gone back to work, but I really hope that you considered just having orientation days where staff can come in. I really hope that you haven't had your staff come straight back in and go straight back up to the fly floor on a fit up, because we're starting to see things like people are having foot problems because they've not been wearing steelies for 12-hour days. I know my husband's had plantar fasciitis because he's just started to put his steelies on, and he's just not used after 16 months to having his steel toe cap boots on for so long. And again, I'm just going to stress this one, 68% of people think there won't be adequate mental health and wellbeing support for their return to work. So there is a complacency. We just don't think that anything's going to happen. And you know what? A part of me is kind of with them, even though I'm still manically waving the mental health advocacy flag. I think it's time that we start doing something now. So I'm going to move on to my highlights. I'm going to just, are you still with me? I'm going to put the chat up because I just feel like I've been talking for a really long time. David, are you still there?
Oh, yes.
Lovely. Okay, cool. I'll whiz through this and then we can go straight onto some questions, but I hope you're all right. That was a lot of data to take in. The report itself is a fairly long report, but the executive summary sums it all up. And I also put a page of recommendations up as well. So the highlights for me, nearly 3/4 of our sample size identify with being freelance. So how are you going to start thinking about well-being and mental health care provision for your freelancers? So the first thing that I think you need to do is to acknowledge how many freelancers you have. Only you know if you employ a lot of freelancers. And when I say freelancers, I'm also going to include our 0-hour contract casual staff in this as well. You don't have job security at all. So I'm going to include 0-hour casual staff and freelance in the same category. It is no longer acceptable just to hire these people and not acknowledge that they are part of your workplace. So I think it's time to make a commitment to looking after them, especially if you know that you are repeat hiring the same person as well. And if they're with you for a prolonged period of time. 50% of our survey sample are thinking about leaving or going to leave the backstage profession. That's worrying and slightly alarming. As someone that works in education, it also somewhat breaks my heart even. What are we going to do to make them feel valued and encourage them to stay? So at lower levels, we are struggling at the moment to find technicians. We're struggling to staff our pantomimes. There are lots of job opportunities out there and not enough people to fulfill the roles. So we need to make our industry attractive again. We need to make it that we are looking after our human beings. We definitely need to look after the ones we have better so that we don't lose them. And we need to encourage a better cultural change backstage in order to attract more. Our line managers think that they're open and that people can talk to them about mental health, but our workforce are not confident to talk to them. I really don't know what to say. This sort of speaks to itself. If you're a line manager or you're in a position of authority or you're a supervisor, dig deep, put your hand on your heart and say, really, can my staff talk to me? Yeah. Why don't you just ask them if they're comfortable talking to you? And I suspect you'll probably get your answer. Do you actually have time? Do you actually have provision in place Do you have time in your day? Are you so busy that actually the more practical business-based stuff takes a priority over your human beings that you're managing? And really, you just have to put your hand on your heart and work that out for yourself and work out. But there's lots and lots of strategies and training in place that can help you develop that further. The pandemic's effect on our industry has caused a negative effect on everyone's mental health. So this is the big one for me. We can't just come back as if nothing's happened. It's just not cool, and it's not acceptable to do that. You can't just pull your workforce back in after 16 months of being closed and expect everything to be okay. So the first thing you need to do is acknowledge and not be in denial about what has happened to our industry in 16 months. And the slogan "Reset Better" has been thrown around, and I think that we've forgotten it. We've come back to work and we've just come back with a vengeance, and we've forgotten all of the great work that we've done in the dark time that we had, and we need to start prioritizing it. And lastly, in here, we had 1,240 odd people that took the survey, and they gave us a very, very, very clear message that the cultural change towards well-being and mental health backstage has to change. And again, my challenge to you is, how are you going to do that? And the first thing that you need to do is make a commitment to make that change. I'm just going to pop my recommendations up there very, very quickly. Acknowledge the high prevalence rate of mental health in the backstage industry. You're going to have more people that suffer with mental health in your backstage workplace than the higher the national average. So it's really important in risk management to make sure that you have a provision for that. Again, commit to being proactive in the provision for the support of staff for mental health and well-being. When I say that, I don't mean that you have to fix them or provide talking therapy for them. Sometimes it could just be about successful signposting. None of us are here as a trained psychologist, but it's about having that empathy and that sympathy and that understanding in the workplace, and having the provisions in place to make sure that people know. We put GP numbers in our backstage area for our actors and our touring staff so they know where to go. Start signposting to some of your local authority mental health provisions, because there's some great provisions out there. And again, I'm popping all of this into guidance notes, so hopefully that will help you. Again, work to better understand and offer empathy towards the needs of mental health and well-being for the workforce. This comes more naturally to some people than others. So my advice to you is, if it doesn't come naturally to you, then maybe you're not the right person to be a mental health first aider. So I think that when we send staff on a mental health first aid training course, have a little think about whether they're the right person to do it. And I'm just going to leave that there. Pledge to work on creating and cultivating a positive cultural change backstage. It doesn't work if one person's doing it. So I advocate it, and I feel like a lone wolf with a tiny flag, waving a flag in this. I need more people to jump on board with this dream, that actually we're going to start to put people first backstage, because it's the people that make the shows. And again, the best way to promote a cultural change is communication. So work to promote a culture of communication on mental health and well-being, and one where people are safe to talk, that they feel safe, but also that they can be heard, so that when they are speaking, it isn't just blown in the wind and forgotten about, that they are heard and something is done about it. And I'm just going to end with my mantra, basically, that you don't have a show without human beings. Human beings make the shows, they act in the shows, they are the shows. So it stands to reason that if the industry's greatest asset is the people that make up its workforce, you need to look after them. You need to preserve and maintain a good end product. It's important to preserve and maintain the people that make that profitable product. So it's time to take wherever well-being and mental health is in your strategic business plan and put it straight to the top, because it's human beings that will meet every single one of your business objectives, every single one of them. If your business strategic plan is to improve sustainability or to come up with policies to improve equality and diversity, it's going to be your human beings that come up with those innovative ideas. So if you look after them and prioritize them, they will fix every single one of your business strategies. And I'm going to stop preaching now. So that's the last one.
Well done. Thank you. I mean, we were talking about this earlier, and you were saying that perhaps there should be sort of a practical production manager point of view. I mean, you did, of course, cover everything, but in the end, a happy workforce, a workforce that feels it's listened to, is going to be more efficient. They're going to be much more creative. You can retain a workforce who are engaged and feel supported. And, we are in the industry is having a real problem at the moment. The temptations of film and TV have proven to be too much for many people, understandably. Vector promoted it. And also staff recruitment. People are not going to be very interested in going to work for an organisation that they're aware doesn't support its staff. The simple, mental health welfare is a sensible business practice. And if individuals aren't supported, and they go off, and they will be going off for much longer than they would do if they have the chance to actually address their issues earlier on. It makes perfect practical and business sense to address this, as well as the obvious fundamental moral requirement to do it.
I do think, whilst we're ambling around this topic, David, I do massively understand the trepidation of broaching this minefield, if that makes any sense. So obviously you've got mental health and well-being. It's largely misunderstood, I would say, probably within its own sector as well. The NHS, it's well documented that the NHS haven't quite got the provision for it right, and it's underfunded. So I do understand that from a business point of view, it feels like you're opening a can of worms or a minefield. So at the ABTT, we are committed to this, and we are going to be working on guidance notes, tangible guidance notes, offering, what we're doing is collectively gathering together resources, contacts to inform these guidance notes. The first one we're going to work on is freelancers, because of course that was absolutely 100% on there, and I just started work on it this morning. So there you go. I'll hold me to rights later on about it, but I've just started work on the freelancers one. It is a minefield, but I think the most important thing to remember is that you're not a trained psychologist, you're not a doctor. You can only do the best that you can. In health and safety, we talk about, I'm just remembering what Phil used to tell me, reasonably practicable is the word, isn't it? Reasonably practicable. Well, just apply that to this, yeah? Nobody's asking you to fix somebody's well-being and mental health problems. All we're asking you to do is to look at it from a reasonably practical point of view. Are you doing everything that you can? When I go to the toilets at White Light, they have the Samaritans number. They have all of the local services for mental health provision on the toilet doors. Because where are you going to go when you're upset or in crisis or a bit? You're going to go to the loo because it's private. Do you see what I mean? And that is, as far as I'm concerned, a commitment to a cultural change, and that is reasonably practicable. And it just creates a culture. I go into White Light and I feel like, as a mental health patient, my heart was beaming when I saw that in the door, and it just makes you feel like that is an organisation and structure that looks after you. Do you know what I mean? So I guess the biggest thing that I can say to you is it doesn't have to be as vast and as big as you think it might be. Just start somewhere and start chipping away for it, because even if it is that you just put a sign on the door, at least you're starting that journey towards a cultural change.
There's an interesting question from Kevin, which kind of, it's about setting the tone, isn't it? Setting the environment. And he asks, should there be mental health element in the toolbox talk at the start of the working day? Yes, however, what does that look like?
God, I hadn't thought about that. It's a brilliant one. That yes, I think perhaps there should be. What should it look like? I don't know, but let's start it. Let's start somewhere. Let's put something in there. We tell people where the toilets are, don't we? If you've got mental health first aiders, then why don't you mention that in the, There is actually a campaign that Mental Health First Aid England are doing at the moment, and it's called the My Whole Self campaign, and it's all to do with the communicating ourselves more at work and not hiding, and that's the idea behind it. So maybe you could start your toolbox talk by just asking if everyone's all right, and I suspect the first time you do it, it will be terribly British, and everyone will be like, no, yes, we're fine, yes, we're absolutely fine. So there is a rule of thumb that you should ask if someone's all right 3 times, and on the 3rd time they might actually tell you. But again, like, how lovely would it be if your toolbox talk started like that? Do you know what I mean?
And it sets the tone, doesn't it? It proves that it's a matter that people are concerned, the venue or the company is concerned about it.
Kevin, that's an absolutely fabulous idea, and one that I will jot down and consider popping in our guidance notes. So thank you, Kevin. Keep them coming. They're good ideas. Yeah.
And there's a couple of other questions there. Don't need me to read them out.
Other than presenting these findings in this wonderful set of webinars, where else should we be presenting? Should or are we approaching the main employers and industry organisations directly? I'm having believe it or not, Robin and I are having lots of conversations in the background, aren't we, Robin? We've been talking to SALT, UK Theatres. Kevin and I have been talking at BECTU. So there is a desire, and what's lovely is I'm busy and lots of people want to talk to me, which is great. I think that there is a worry for me that there's a lot of talking and not a lot of doing. So I think it's really important that we stop talking at some point and start doing. And even if, like I said, even if those things are small. So Kevin, that's a really good idea. There's lots of you that have come from regional venues here today. My challenge to you, pop it in the toolbox talk. If you want to change your cultural stance to wellbeing, then pop it in there. It's at least it's a start towards a commitment to it. But yes, so Sebastian, there are lots and lots of talks, and obviously we are looking at trying to bring some cohesion to that. AAPTLE is a really good place. If you don't know much about AAPTLE, they're the Alliance of Professional Organisations, and AAPTLE are bringing all of these little associations together in a really powerful way where we can begin to start talking and sharing good practice.
Ben's got a question there, which kind of speaks to the despondency the industry feels and the lack of agency people have really, and how does one actually address this?
How do we ensure the leaders of our theatres and theatre company and producers see this presentation in the accompanying documents? If we, as their staff, don't feel like they can speak to them about them, it's hard to send them. Yes, Ben, this is my gift to you. Yeah. So I completely understand, and I think that my commitment and drive to do this completely unpaid is because I care that much about it, and because the reason I did surveys is because I'm blissfully aware that businesses require data. They require a tick box. They require something to prove its worth. And I think now statistically, we have more data in the UK in our sector than any other place in the world. We've far outdone America in terms of our data in this particular field and area. So Ben, my advice to you is, what I will give you is I can't solve that if you feel comfortable talking to your workplace, but what I can do is say that this survey report and the 2019 survey report does not sit behind a paywall. So if you go onto the ABTT website, you do not have to be an ABTT member to access this survey report. You can download it as a PDF and take it to your workplace. And if they haven't read it, then perhaps ask them to read it. And there is guidance notes. There will be guidance notes that that come out. So like I said, we're going to work on the freelancers one first, and then we'll start to look at, I will produce guidance notes for you with some tangible links and things in there for you.
And I think probably it's worth mentioning that the work you've done, Mig, I'm sure you wouldn't mind me saying, but it's trying to contribute to the landscape of information and awareness, and we completely recognise that we're not the only people, and APTLE recognise it's not the only organisation that's helping to build the knowledge base and information base about the current state of our industry, and also the priorities that we need to address to move it forwards. And it's probably worth mentioning at this stage that another element of that jigsaw is the National Arts Wellbeing Collective. And I know Guy was with us at the beginning of the call, if he's not already still on the webinar, who was at the centre of championing the creation of the National Arts Wellbeing Collective, and with some of his colleagues and the good auspices of the Royal Albert Hall, established that as a forum. And despite a natural hiatus that the pandemic caused, we're now at the point where the strategic partners and the membership, which I think now numbers over 60 organisations, and perhaps redresses the balance a little bit in terms of being a forum that employers are accessing and are seeing information through that channel. The collective is now at a point where it's considering how to move forward post-pandemic and establish a sustainable pattern of activity that will allow it to act as a forum for the more employer-based side of the industry to access this kind of information and be on the same page in terms of those priorities that you've been identifying today, and which people who are in work are very aware of because it affects their own personal lived experience in the workplace. So we are very happy to share all of this, as you've already stated, and it is going into a bigger framework of awareness and enthusiasm for being informed and understanding what the priorities are to go forward in terms of improving the situation wherever possible.
Interestingly, I don't know if Ben's still on the session, but I've just reread that question, and obviously even armed with all of the data, oh, he's still there, good. Even armed with all of the data, how do you make that initial, by the way, please could you do something about mental health? Do you know what I mean? I totally understand and get it. My advice is there's power in numbers is the first thing. So if you and your backstage team all feel that same way, then perhaps you could present it all together and do it that way. And again, without sort of like offering too much of my services, because I'm only but one person, I've got a gob on me, so you're more than welcome to get in touch with the ABTT. If we can gently offer you any support on that, I would be more than happy to help. But I do appreciate that it is very, very difficult, especially if you have been that dynamic that's come across in this questionnaire, where your manager thinks it's okay and actually you're absolutely petrified and you don't want to talk to them at all. Sometimes though, it is easier to present data and statistics. You can gently print it out, pop it on someone's desk and say, I would quite like to do this. In our workplace in the university, we have a wellbeing champion, so you might consider looking at having maybe self-appointing yourself as a wellbeing champion or something along those lines. That's not a bad way of looking at it. Someone that's got a little bit more headspace and time, and it doesn't always have to be someone in a managerial position. So we have to be sort of slightly sympathetic to our managers in the sense that they are trying to reconstruct our industry, having been shut for 16 months, and obviously we've got loads and loads of financial issues and other issues and whatever else. So perhaps at the lower levels, at technician levels, we could advocate that we could become a wellbeing champion and take some of that burden. Because like I said, that cultural change can just start by signposting bits and pieces onto the toilet doors, or it might be that you start some sort of wellbeing activity or initiative. the ALPD, so the Association of Lighting and Production, can't remember the last letter. What is it? Anyway, so the lighting lot, they have a wellbeing working group. So they have a wellbeing working week, and Bryony hosts a reading club, a book club. Now, listen, a book club might not be for everybody or whatever, but just adding a human element into your workplace just makes it the dynamic of, it makes it a more attractive place to work.
Sorry. Started speaking, then started coughing. National Theatre Wales, for whom I work, Nia Thompson, who's on this call, production manager, show for us, she is our production manager, and applied the Reset Better standards. And so work finished at 6 o'clock. There wasn't very much Saturday work, and that was very much driven by ensuring the welfare of all concerned, and it was achievable, and it was very successful. And we're restaging that show and using the same standards. It's not open to everybody, but it made from a very happy, very engaged workforce, which was quite successful. And if people don't know about Reset Better, there's a charter that's available and easy to download. And knowing it this year, it'll probably appear in the chat in about a second.
Probably.
But it's it is a helpful sort of aid memoir as to how you approach making work, and actually starting to put people at the centre of your decision-making processes. But also from a sustainability point of view, a lot of us are using the Theatre Green Guide book, and one of the things is about investing more in people, and not investing, not buying new, but spending the money on human beings, and that is another element whereby it is about putting people in the centre. And if you're going to put people in the centre, you need to look after them.
And this might be a completely hippie concept, and you might think that I'm mad with it, but I do think that human beings are the finest computer in the world, and they problem solve. We make computers, we build computers, we are the problem solving aspect of any business and innovation. And so, and we've just been through this like almost apocalyptic thing that's happened, where all of our societal structures and norms have changed. We have to be kind to ourselves, and we have to start putting ourselves as a priority and looking after our human beings. You will see productivity shoot if you just bring an element of kindness and the human touch into the workplace. I feel like I'm a broken record talking about it, but it is statistically, you look at the Nordic countries and some of the values that they've changed over there, and their productivity has shot up. So I do think that it is just looking at that cultural change. We don't have any questions, but I've just been starting to write a guidance note already, which is on freelancers. I found some great resources that are, it might be worth me sharing now. Alicia, have you got the Hub of Hope one?
Hub of Hope.
The Hub of Hope, it's brilliant.
I do. I will post it now.
Yeah, so Alicia is going to pop this little link in here. This is genius. So the most important thing that you can do is you need to establish in your workplace, like, so if you're so I know for a fact, because I've looked at the guest list for this session, there's lots of regional theatres. So the best place that you can start to signpost to activities that are local and resources that are local to you. So for example, I live in Surrey, and as a mental health patient, I'm very, very familiar with the resources that the NHS offer in the Surrey region. Okay, so the link that I've just given you is an NHS link that was hidden in an NHS page, and it's called the Hub of Hope, and you pop your postcode in it, and you also just type in the kind of resources that you want. So it might be resources on depression, it might be ones on alcohol addiction or whatever else. And then everything that's available in your region under that postcode will pop up as a resource for you. And that's the perfect place to start. You can then start signposting. Your mental health first aiders can then have bits and pieces available to them in order to signpost people as people do come to declare that they're perhaps not doing so well. There's also safe havens. There's so many. Unfortunately, it is a bit of a postcode lottery as to what kind of resources that you have available regionally for you. But that is just the most genius piece of resource ever that I found. You also have there's obviously like, and then obviously, sorry, I'm just thinking, I'm going mad now. If you work in an establishment where people travel to, so you've got lots of freelancers, but they might come from all over the country, then you're probably going to have to be a little broader with your resources and your signposting. So it's going to have to be sort of more national lines, along the lines of the Samaritans or Mind or things like that. We also have a lot of industry support options available to you as well. So we've got the theatre, we've actually got a myriad of phone lines. Don't get me started on phone lines. That's a completely different kettle of fish. But anyway, they are there as a resource should you want to use them. So you've got the theatre helpline. You've also got the music support line. And we've got the new backup wellbeing line as well, which I've said all of that. I don't know whether Alicia's got it all, to be honest. I'll pop them all in the chat in a minute, so that's not a problem. And then you also have the ABTT mental health page. Alicia is forever updating, so there's lots and lots of information on there, and there's information from the Zero Suicide Alliance, which offers you help and support on that topic, which is so stigmatized. There is also the Mental Health Charter as well, which is just I use it all of the time. It's a really good resource, which I will put up for you also. But the resources are the place to start, really, and then just watch this space, I guess, for some guidance notes. I can't see any more questions, so I'm not sure that I'm going to be able to talk for much longer. As if anyone's got any questions, now's the time to grab me, because I've got a busy diary otherwise.
There was somebody was asking about connecting with you. We'll make sure that comes out of the chat and you get that, Mig, and you can contact them later. That was Laura, I think.
Okay, yeah. So yeah, within
Lauren.
Listen, I'm so passionate and I'm so committed to this topic, and I'm so willing to help and support. And obviously, as an ABTT trustee, I'm going to work really hard to produce guidance notes. So bear with me as I do that. The resources page we keep really updated at the ABTT, so go on there and have a little look. If it's new and we endorse it, then it will be on there. It will be on that resources page, so go and have a little look at the resources. Anything that we have done in terms of mental health and well-being seminars are recorded, so this session is recorded and that will be popped up there as well. So Ben, like you can direct someone to the report. They don't need to necessarily read this bit, listen to this bit, but they can definitely look at the statistics section that I did at the beginning, which is a shorter 30-minute section just on the data and the statistics, and do it that way. But if I can help, I don't, for my own well-being, I don't have all of the time in the world, but if I have the time and I'm free, I'm more than happy to help anybody. And if it makes your workplace a better place to work, then I'll be committed to help you try and do that. Right, I'm just starting to put a load of data in for you now. So I've just put some information about Mind in there. Bear in mind that Mind is a national charity, but they also have local regional groups as well. So again, I'm very, very lucky. I live in Surrey, and my local Mind charity is in Kingston, just down the road. And I actually do art therapy with them. It's I don't pay for it, it's funded. So I do an art therapy online course with a lovely lady called Edit. They also do like running clubs. They have like coffee they can now that COVID just seems to have disappeared for a little bit. They do coffee mornings and stuff. So don't just because it has a national area doesn't mean it doesn't have a more localized one. So I always recommend mine because they've got really, really active bits and pieces going on. And then of course you've got the Samaritans, and then I'm just going to pop all of this in together. There you go. So that's all of your resources for industry resources: Theatre Helpline, Theatrical Guild, music support. This one here is the mental health charter, and it's the document that I think is really, really useful for you. If you go onto the document, again, it's just like a Bible of information and signposting that will help you, especially if you're a mental health first aider. And the last one that I was working on this morning at 6 a.m, because that's what time my child gets up, is there's a couple of really interesting apps available. Okay, so Thrive, I'm pretty much just sharing the information from the guidance note now. Hang on, here we go. So Thrive is an app and it is endorsed by the NHS. And it's a bit like the Headspace app. It offers exercises and advice to reduce anxiety and stress, and it's like to do with mindfulness and stuff like that. The reason that I like Thrive is that it is linked and endorsed by the NHS, and it offers some really interesting, it links into the NHS structures. So you end up doing, you can do questionnaires that tell you how far you are on the depression and anxiety scale, and it will then signpost you to go and seek help. So if you're scoring high in those questions, it will then signpost you straight to a GP straight away. If you follow the music support link that I've just popped on there, at the moment they're offering it for free. Quite how long that goes on for, I don't know. But if you follow that link and click on live events, that you work in live events, you can get a download of that app for free. And then you also have the Headspace app. So the Headspace is a subscription app, but they do offer a free version of it, and they offer daily podcasts and mindfulness exercises, which incidentally I'm absolutely rubbish at. I can't do mindfulness at all whatsoever. So, but if it floats your boat, go for it. But I do listen to the podcasts, and the podcasts are really interesting. It just gives you some insightful stuff to think about your work-life balance. That's it from me. Has anybody else got any other questions, burning questions that they'd like to ask whilst you've got me?
Or stories they want to share?
Or stories you want to share, or perhaps a problem or something that you'd like to address in your workplace that perhaps I can give you a bit of advice on, or perhaps what I would do or where I would go to look at it. Anything like that, really. Have a little think about it. But the guidance, so what am I working on next? I'm working on guidance notes. The first one that we will produce is to do with freelancers. So it will be what what businesses need to do to support freelancers, but we'll also produce a guidance notes of what freelancers can do to help themselves as well. And then we will move on to do backstage workplaces. We might look at the touring environment, and then look at residential theatres and in that kind of thing. We, as a part of the AAPTLE Wellbeing Group, we do desperately want to have a little look at that high statistic in students. So it was 57% prevalence in students. So much as I'm loath to start another questionnaire, at some point we probably will have to look at doing a little bit more study into why the prevalence is so high with students. But so the next questionnaire we'll do is will be for sort of the under 25s, I would say, or maybe under 23. So students and graduates, basically. And we'll do it that way. But if any of you have any, so I can't stress to you enough, the work that we do at the ABTT is sort of reliant on what it is that you're after and what you need. So if there is something that you need, then just let us know. I'm going to say, because I think there's a couple of people from the AAPTLE Wellbeing Group here. If anyone's got the AAPTLE Wellbeing email address that I can't remember off the top of my head, please feel free to put it into the chat. But so you can email the AAPTLE Wellbeing email address that someone will magically come up with in a minute. or you're more than welcome, at the risk of Alicia's inbox being full, emailing the office at ABTT, and they will pass that information on to me. But if there is anything that you think that would help you, or anything that you would like to see in these guidance notes, please let me know, and I can prioritise that.
Thank you, Mig. That was tremendous. So much material covered there, not least, obviously, the findings of the survey, which is incredibly important, illuminating and significant. But also, thank you for explaining all the activities that you are continuing to work on. I guess in terms of good practice, it's probably time we let people go to have lunch, so that their sustenance is assured, as well as their well-being. But thank you so much again for a fantastic presentation. I know obviously that you did originally present these statistics at the ABTT Plaza show this year, but as we are very aware in the ABTT, it never is harmful to repeat the information so more people get to hear it. And as you said, we would be very happy if anybody wants to get in contact with you. If you'd like to email office@abtt.org.uk, we'll pass any messages on to you and you can deal with them.
I should also say, Robin, as well, that if anybody is really, really passionate about that and would like to join the AAPTLE Wellbeing Working Group, then do please get in touch also.
Thank you very much. Thank you, David, as well, for your contribution and perspectives, always interesting and useful. And we should thank the amazing Alicia for providing so much information. As soon as it leaves our lips, it's phenomenal. I'm sure there's some skullduggery going on. It's an amazing feat. Thank you very much, Alicia. But if there's nothing else, which there doesn't look as if there is, we should say have a very good lunch, have a good weekend, and be very well. Thank you all very much for coming. Bye.